pelvic floors, I always talk about, it's responsible for peeing, pooping, and penetration. So we got to keep all those functions well.
Yeah. And honestly, one thing that I think would be good to talk about, since we didn't dive into it too much, if you're comfortable with it, is talking about sexual health as you age. Like, I'm not able to orgasm as well as I did previously, and my sensitivity is not there. Like, all of these things, we were just
I had a call with one of my new mentors, and he shared a statistic, and I posted about it and people took it the wrong way. I talked about how as humans, we are meant to have sex multiple times a week to keep good blood flow and to, like, more on that aspect. People are like, no, stress and life, and how can you even expect that? So, and I was like, no. Like, I mean, like, to help keep nerve function and blood flow in the area. Like, it's a physiological thing that we're into. And he mentioned,
so they were arguing that they thought they shouldn't have sex a couple times a week?
I would completely disagree with this. I think this is bogus. Like, multiple women reached out to me when I posted about it. I was like, no, first of all, like, when you're optimized, yes, I think you should have a libido to where you want to have sex a couple times.
Ideally.
And I have experience. I think also long story short, like, totally trashed my body competing in CrossFit for multiple years in my 20s, training multiple hours a day. Like, I've worked hard to get hormone levels back, and like, they haven't come back. And so I went on testosterone, moderate dose, not crazy doses, and night and day in terms of like my sex drive, my desire for it. And I was like, I didn't hate it before, but it wasn't just like, and now I feel a huge difference. And I'm like, oh my God, this is nice. Optimization is nice versus like normal,
It is amazing. And so we speak about this for any hosts that want to go into this, that we rarely have women join our signature program to recover that function. Believe it or not, some of them join for pain with sex. Nobody joins to optimize their sexual function, but we get so many comments on the side about it. And they're like, wait, I didn't know this was going to happen too.
Yeah. Well, let's talk about that, because I'm a big fan. I've probably been more of the sexual one on the podcast, talking about, like, I think you should want to have sex with your husband. Like, it should be fun. Like, how do you keep a relationship alive? And I don't know. That's bogus. I feel bad for those ladies not wanting to have sex multiple times a week.
People get really angry at the post and they're like, I can't believe that.
Well, they're angry because they're not having orgasms.
Yeah. They're angry. They need to work with you ladies and get the hormone situation and the digestive health optimized, and then get a little pelvic floor strength in there, and then we'll really be rolling.
This study was done on men, and I was like, no, like, oh my God, why are you so sad?
Oh man.
Yeah.
So anyways, would love to talk about that. But one thing that he did say that I was like, I'm sorry, I don't even know if he said that you should be able to orgasm multiple times during a bout of sex. And I was like, no.
I'm not actually 100% sure on that. And I think it really depends on the woman. I do think we're all made a little bit differently. And is it clitoral? Is it internal?
Yes.
I think that point he made is debatable, honestly, but
yes, agreed. So anyways, yeah, I would love to dive into that, because I think I'm much more comfortable than I think I used to be talking about it. Liz is very comfortable talking about it. But yeah, sex life and how this affects.
We're always, we don't go to some kind of crass place either. Like, we speak to a large audience of, Christian women, and it's moms, and it doesn't have to get ugly, but we do deserve to have a healthy sex life, and it's important for our marriages.
100%.
Yeah. All right. I'm excited. I think this is going to be really good. And we're probably going to get some really good reels about it, because we're going to have sex with orgasms.
Nice.
And I'm going to tell us, I'm sorry if you don't have sex multiple times a week. Maybe you got to tell your husband to.
Yeah, maybe this needs to be something you work on.
Yeah, and communicate with him about how to help keep you happy and satisfied a little bit better.
I saw a great reel the other day, and it was a guy doing it, talking about, he was like dressing up as a girl in one half and then himself in the other half. And he came into the room and he goes, hey girl. And it was like his wife. He's like, hey baby, I'm ready. Like, do you want to, I feel like I'm ready right now. Do you want to go right now? And she goes, I'm going to pause you right there. And she started talking to the camera. She's like, he works differently than I do. Men are able to get in the mood immediately. Females need a precursor to be able to get in that mood. Like, we need the warm up
and the non-sexual touch and the,
words of affirmation and all those things.
We need the touching first versus like, let's go, I'm ready. So I'd love, that piece too. It was a great I was like, oh, that's a great reel. I love that.
I love it.
So
All right, let's do this. I think we're recording. I hope we were recording because I'm sure we could just pull out a little clip there from the pre-recording show. That's the best.
Oh yeah.
Yeah. Okay. Are we ready? We're ready. All right. Welcome back to the Health Revival Show. We are so excited. We have Christina Walsh with us today. She is a New Orleans mama of two, just like Becca and I, mama of two. And she was living with pelvic floor issues, but she has turned her pain into her purpose. And so now she has a signature program called Tighten Your Tinker. I love it. I was like, every time I say it, I just get a little like butterfly. Tighten your tinker.
And we are not that cute and clever. My partner and I, a client actually named it for us. She was like, well, I mean, the alliteration, it's to be cute and memorable and clear about what we're talking about without being crass, so Tighten Your Tinkler it is. And here we are.
I love it.
So Southern too.
I love it.
That too, I guess I forget about that part.
Yes. I feel like only a Southern girl would be like, Tighten your tinkler.
Right.
I love it. Oh my gosh, we're going to have so much fun today. So you guys are in for a treat. We're going to talk all about taking the panic out of prolapse. We're going to talk about the orgasm in the female body and how we need that. It's important for health, not just for enjoyment, and a bunch of other stuff. So get ready to strap in for a ride today with us. Christina, please introduce yourself to our listeners and let them know a little bit about your story and how you got into this.
Yeah. Well, as you said, mom of two, I'm a licensed physical therapist. And, we come to our passion and our purpose in often circuitous ways. And we don't know in what form our blessings will be given. And that's my story too. And I think back and I think seeds were planted as the oldest of four children and the oldest female child. I watched my mom deal with a lot of what I now know are core and pelvic floor issues from having all four of us kids. And I remember wishing I could help her. And I didn't know how. And I think that's what drew me into being interested in healing professions and healthcare. And I was a natural kind of helper anyway. And I was led to physical therapy and I graduated and I thought, I got into outpatient practice. I did home health and I thought, this kind of isn't what I had in mind. And my first, unexpected blessing came in the form of a neck injury, actually, where I ended up learning craniosacral therapy through that and felt incredibly called and delighted I'd found what I was looking for, and then had a couple babies, met the wonderful Jen Lorman, who's an exercise physiologist extraordinaire. And she was already on the warpath to recover from some more traumatic births. I had had much more natural births, and the two of us united because she ended up on my table and was like in my craniosacral practice and was like, this is incredible work. She was already training moms in her personal training gym, was like, all the women I treat need this work to help facilitate their healing. And then the two of us became aligned at solving our own post-birth issues, core and pelvic floor dysfunction, prolapse. And she was being recommended to have a major reconstructive surgery of her whole pelvic region at 36 and was like, absolutely not. Meanwhile, I had had these natural births but was still dealing with these residual issues. We had tried Kegels. We had really investigated what was out there. And thankfully we had this professional background to be like, there's got to be a better way. All this can't be it for these muscles. And so we found a better way. And then we got the harebrained idea to validate the protocol because we are total nerds for what we do. We're like, we got to turn this into data. Like testimonials aren't going to be enough to change the world. We have tons of those. But we did a 3-year university research study with a professor, had no idea what we were getting ourselves into there. But it is published in a peer-reviewed journal, and it proved that a non-invasive holistic protocol for many to most women dealing with these issues is enough. And so it's been life-altering for us. And it was the women in our research who came back and were like, please put this online, make videos. And we were like, we have to listen to these women. They helped us name it Tighten Your Tinkler. We dove into another crazy thing of starting an online business, and here we are.
I love that. And it's funny because I'm thinking right now, I'm like, yeah, a lot of women are recommended these surgeries to repair tearing, prolapse, whatever it might be. And I'm like, someone goes and tears a hamstring, they're not like, nope, we need to go in immediately and sew it back together. And you're going to have, and then also you're doing physical therapy for multiple months after that, but never are we recommending physical therapy for females post-birth. And it's like, oh yeah, that's a great idea. Good idea. It's never, this needs to be done.
Totally.
Because this is what happens during birth. And so it's ridiculous. And I'm sure as a physical therapist, like you see all types of, tears and different things in other parts of the body too, but why are females treated differently postpartum?
Yep. And we hear all all the stories. If you just go noodle around on our YouTube channel, even just briefly, you will see on this very public platform, women pour their hearts out under these videos because the way we teach, it's the first time, often after seeing many medical providers, it's the first time that they have felt like, oh my God, I'm not alone. I mean, they're like, I'm crying right now. I can't believe my doctor said this was normal, or I just had to live with this. And they're getting gaslit and shamed and, not believed and invalidated. And those are, of course, not, but those are the women who find us because they're like, wait a minute, this can't be it for me. And I'm so glad women aren't accepting that and looking for other options. And thankfully now there are multiple ways to address these issues and to heal.
Yeah.
Yeah, I was actually just talking with a lady last week and she has very low estrogen. She said her vagina feels like sandpaper and she has a lot of incontinent urine leaking, mostly at nighttime. And I was just talking to her about the power of estrogen creams, suppositories. She said she saw her OBGYN and they basically told her just to go to pelvic floor therapy. And I was like, yes. And
yes,
they've given you a partial hysterectomy here. You have unreadable testosterone and your estrogen is very, very low. Please start utilizing some suppositories to support that tissue,
yes.
And so we talked a little bit in another episode with the vagina coach. I don't know if you follow her, but she's great too in pelvic floor, and just how estrogen's so important for the integrity, not just of your pelvic floor, your vaginal tissues, but also the urethra. And so why we sometimes, see reoccurring UTIs and things like that. But, I would love to hear from you. I think many women just think that this leakage is a normal part of like aging for those who haven't had children, or they just think it's normal because and honestly, so we used to own an all women's strength and conditioning gym. And we would hear all the time from people, I can't do those box jumps. I can't do the jump ropes, right? I'm going to leak. And so it's one of those things where I would even tell them this is not normal. Please see a pelvic floor therapist. Please seek out other alternatives. So let's dive into that. Debunk this myth that it's just leaking, as we age.
Absolutely. Well, and I think so many women are stuck with this because either they don't have access to care or no one has referred to the right care, or because this has been going on for generations of women just being forced to accept this. So their mom had it or their friends have it. And it does not have to be forever your new normal. And what this looks like is a little different for every woman. And core and pelvic floor dysfunction, moving into prolapse, which is where the organs start to actually fall out of place, can present with an array of symptoms because it's dysfunction at your core, at your center of gravity. And all your back and hip muscles connect there along with your pelvic floor. So it's some of the traditional stuff that women think about probably first when we say pelvic floor. So it's the leaks with laughing, coughing, sneezing, jumping. It's the gotta go now leaks. It's peeing more than 10 times a day also is dysfunction, even if you drink the recommended large amounts of water that we should all be drinking that are also important for our pelvic floor health, incredibly. Getting up at night to pee, also not normal and not something you have to live with. That is mind blowing for most women. Are you sure? Yes. And that's often the first thing that actually gets better and goes away when they begin to work with us and re-strengthen and heal that area. Another thing is that pressure or heaviness. Some women talk about, for me, it feels like I always say pressure and heaviness because that's what it has felt like for me. Some women describe it as a bulge. Some women describe it as there's a tampon stuck in there and inserted wrong. Some women describe it as the end stages of pregnancy, but you're not pregnant anymore. Most of us who've been pregnant can relate to that feeling. None of that. That's all indications that something's wrong down there and you should seek care. You deserve to receive care and things can get better. Another thing is an overtight pelvic floor, which is also a weak pelvic floor, which some of these symptoms present very similarly. Women go get those internal devices. They go do Kegels. And guess what? Things get worse. Because if it's already over tight and you're bracing and squeezing, you're not gaining functional strength. And so if that's you, there is still a path to healing, but it does not involve any more bracing or any more isometric squeezing because that is not going to get you that functional strength. If you're listening, you're like, oh yeah, wow, that's been my story. And a lot of those women end up finding us because our approach is functional and much more holistic. Not just that's isolated bracing and squeezing, which can lead to that over tight pelvic floor. Another thing is low back and hip tightness. If you're one of those women who's like, God, I tried to do core workouts, but it's always in the front of my hips. My hip flexors are always so tight. I can't sit Indian style anymore. My back wakes me up at night. All of that is a part of this whole picture of core and pelvic floor dysfunction. And last but not least, pain with sex or diminished sensation is also a part of this picture. So that is a big basket. Now, the good news with all of that being connected is that when we start to give the body the little nudge in the right direction, the direction it wants to go anyway, right? Just like what y'all do in supporting women's health holistically, getting to that root cause, when we start to give it that gentle nudge, all of the rest of this stuff starts to get better too. And that is really the great news about it all being connected and all part of really the same root cause problem.
Yeah. No, I love that. And we, on the previous episode that we kind of talked in a different light on the pelvic floor health, I was 100% the overtight. I had pain with running. I was in competitive CrossFit, so doing double unders and like sets of 100. I couldn't do more than 30 or 40 before I would start leaking, and then it would be like I could. And so it was an endurance thing because of how tight it was on constantly throughout the day. Like it never relaxed. And
Yeah,
so for me, the main answer was being able to get it to
that's
relax
the
so that I
first
could
step.
build back endurance in the strength of it, because it was just over tight all day long. Like imagine squeezing your fist as hard as you can all day long. Eventually you're not gonna be able to hold it anymore. And the leaking then would happen for me. And I
Yeah.
had to basically retrain it. I remember one of the things she told me was, if you're peeing and you cannot count to like 8 to 10 Mississippi, and that much pee is coming out, she's like, you didn't have to pee. It wasn't a full bladder emptying. And so that was like one of my cues that I vividly remember, is like when I was peeing, I would count to make sure that like I wasn't only peeing for 3 or 4 seconds. And then
Right. And so many women, as busy moms and work, and whatever we're doing in work, we get to these bad habits of like trying to push the pee out. And that actually, or because it's so tight down there, you have trouble initiating that stream and relaxing enough to let it out. So you want to exhale, you want to put your knees up higher on that squatty potty, you want to breathe out some, might need to rock back and forth a little bit to kind of change the angle of things to help let it out peacefully. You want to make sure you're not trying to push that pee out, because all of that wrapped up along with often that over tight muscle ends up causing urine to be left in the bladder, which then makes you have to go pee again sooner, which makes you have to get up at night to pee, which puts you at risk for urinary tract infections. So all of these little tweaks and adjustments can really help aid complete bladder emptying and passive bladder emptying, which helps relax and release the pelvic floor. And if you're like, oh my gosh, I'm definitely one of those hypertonic, overtight cases, you're absolutely right. The first step is to get it to relax. You can't retrain functionally a muscle that is chronically guarding and overtight. And so that's where we have our free, we call it our 90-90 decompression technique. You're just going to get into position at home that is easy, simple for 10 minutes. And you're going to take the pressure of gravity off that pelvic floor, off those back and hips. It feels amazing. And I tell my high achieving ladies, you are rest multitasking with this position. You are resetting and offloading your pelvic floor. You are resetting and offloading your hips to your low back, and your nervous system is getting a reset. And nervous system is wrapped up into bladder dysfunction also. Nervous system connects to everything. So if you are peeing more than 10 times a day, or you have those urgency gotta go leaks, I promise you, nervous system is connected to that. It is muscle strength, but you have to down regulate that nervous system. So this active rest, this decompression position at home is the perfect place to start for all of those cases. So you're absolutely right. That has to be the first step before we talk about functional strength. We got to let it relax first. Totally.
no, I love that. What do you find? I know we talked offline a little bit about this. What do you find happens in perimenopause that seems to trigger these issues for women? Because obviously, pregnancy and postpartum, I think that conversation has been had.
Yeah.
Like people know that postpartum does that, and it's, being able to recover properly from it. But what do you find later on in life in perimenopause that seems to cause a lot of
This is
issues?
so pertinent. And so many women end up finding us here because either the issues were not, as we Jen and I say, they weren't screaming loud enough to warrant your attention when the kids were little, or you were just pulled in too many different directions. And then, right? Y'all don't know about that, huh?
Time is abundant right now in my life.
Right. So much free time. But so my understanding, and y'all, as the hormone expert, you can correct me if this is wrong, but my understanding is that estrogen drops by about 50% by our 50s. And that also collagen is dropping with that. And guess what is holding our organs in? And our whole pelvic floor is soft tissue. We tend to think of collagen as related to aesthetic concerns of wrinkles and saggy knees and whatnot. But guess what? It also plays a huge role in the soft tissue of our pelvic floor, which pelvic floor is responsible for peeing, pooping, penetration. So we want all those functions to be really well and healthy for us. late into life. But when estrogen begins to drop, collagen begins to drop, and those soft tissues begin to feel that impact. And if there were, I love the way you ladies talk about this in other from other angles, but it's still true here as well. You often in your last episode spoke about how perimenopause, often we weren't really healthy going into it. We start to have all these symptoms, we blame it. Oh, it's perimenopause. If you had a little leakage before, but it really wasn't enough to take action on, maybe sex wasn't as pleasurable as it used to be, but it wasn't painful. And then, maybe there was a little pressure just when you had your period, but like it wasn't all the time. So those are more ignorable issues. But then we get that estrogen drop, that collagen drop, and all that gets a little worse. And that's oftentimes when women are like, wave the white flag, like, this can't be, I can't live like this anymore. Suddenly you're walking on the beach and you have a pee leak and you're like, I couldn't be wearing a pad and the pee's running down your legs. There you start to go, hold on, this is really interrupting my sleep. My kids are grown. They're not waking me up at night anymore. Why is my bladder now waking me up at night? Like, I'd really like to sleep. And God knows we know how important sleep is. So that is often the time for various reasons, physiologically and, just logistically, that women end up coming in and working with us and seeking help, because it's a tipping point very often.
Yeah. And I think too, one thing we talked about offline, I'd love to touch on here. So you mentioned peeing, pooping, and penetration. Women are also at the same time saying sex is painful. I don't want to, this is not enjoyable anymore. How can I have a great libido? Of course, if you're in pain when this is happening. So let's talk a little bit about that. I mean, we know that estrogen and collagen are very important for the vaginal tissues, not just for the integrity and maintenance. And so we're not getting reoccurring, UTIs and yeast infections and things like that, but also for lubrication. So let the ladies hear it, because I think so many women think this is normal. And it's just, again, another thing that's part of life, and their friends are also dealing with it. But it's like, wait a second, there's so much that we can do here. This is not normal. Maybe it's normal, but it shouldn't be, right? Like, people have normalized it, but it definitely should not be normal if we are living in an optimized state.
Yes. And the approach that we take from like nervous system downregulation, stretching, resetting, rebuilding functional strength is incredibly synergistic with adding the proper nutrition, organ system, and hormonal support, because it then becomes this really beautiful upward spiral of healing. So if you are in need, if you're having the dryness, that is not a strength issue, right? You need the estrogen cream. You two are the expert at that piece, right? So listen to whatever you guys have to say about that. If you've noticed that pain with sex from a lack of functional strength or an over tightness standpoint can present in different nuanced ways as well. And number one is if you have pain with penetration, if you can discern, your body, if you can discern that it is not, or it is no longer due to dryness, it is often that hypertonic or over tight pelvic floor. So the first thing you're going to do is use that at-home decompression position. 10 minutes a day, pre or post. Bring your nervous system to a downregulated state, offload the pelvic floor, let those muscles relax. That is just one type of pain with sex. Another one some women experience is like much higher up in the abdomen, almost like a soreness, like in your gut. And that is often because we talked about the condition of prolapse. It's kind of like progressed pelvic floor dysfunction. Those internal organs have started to kind of shift and fall out of place because, the soft tissue support in there has either been injured or degraded with hormonal change over time. And the organs are literally being impacted, by the insertion. And it's kind of like they're getting punched around, and there's becoming this awkward suction effect. Some women deal with queefing during sex also because air bubbles start to form. Things just aren't in the place they used to be. That's number two. Number three is like swelling and soreness afterwards. So that's often felt kind of more exteriorly, like the vulva area becomes like puffy and sore, or so you kind of feel that increased heaviness afterwards. That is another type of pain with sex. And so all those issues, all three of those can be aided by adding that up and in functional strength again, so that you're not having that plunging effect. You're not having the pain with penetration because you've relaxed and re-strengthened the pelvic floor. And then no woman, to my knowledge, has yet joined our program and come to work with us because of diminished sensation, diminished pleasure, less strength of orgasms. But all of that gets better too when you increase the functional tone in that musculature in the walls of the vagina. So like I said, I don't know if any woman's ever joined and worked with us in our program for that specifically. You deserve that. Your husband wants that for you. This is the quality of your marriage is, in part obviously connected to that intimate relationship you have with your spouse. So if you're not enjoying it, if it's not what it was for you, maybe you're not having pain, maybe it just isn't great anymore. And so many women write to us on the side in an Instagram DM or in our little private community for members. Wait, like my orgasms are better again. Like I'm not leaking anymore, but like I didn't know this was going to happen too, and I was sleeping through the night, like, and so it's just that beautiful synergy when we get the right support and care onboarded, the body knows what to do. And that's what so much of what you two do in other domains, but it all becomes very, an upward spiral of healing. And sometimes it doesn't take that much to start that process.
Yeah. I don't know the exact statistic, but like the amount of nerve endings that are in the labia and the vulva are, I think, more than any other part of the body, like concentration wise. And so think about this, ladies. Like, if you stop working your arm muscle and you just let your arm hang at your side all day long and you're never strengthening it, what do you think is going to happen? It's going to atrophy. But like, we don't connect that to our vagina and the muscles in the vagina and the nerves and the tissue there. Like, it needs love and it needs stimulation. And I'm sorry, but if you don't have that sex life, whether it is, mental, emotional that needs to be resolved or
Yeah.
whatever it might be, like Liz and I have talked about this before on podcasts, you're gonna lose it. You don't use it, you're gonna lose it
Yeah.
1,000% when it comes to the vagina health. And so that, I think, perpetuates then over time of like, okay, now I'm not as confident or I'm not as
Yes.
happy in my marriage. And it just translates and transcends into other areas that I think we think are other issues. But the more you have sex, the more you want to have sex.
Yes.
I don't know.
No,
It's like,
it's true.
And
And
I
yeah, and we don't ever recommend pushing until that pain. Like if you're having those issues, pull back, reset, get the care you need. Don't push through it just to check that box, of course. And you are worthy of not only pain-free sex, you are worthy of pleasurable sex with your spouse, and your spouse wants that for you. Sometimes it's getting
yes.
up the courage to tell him, look, I've personally walked this path, and it is hard to look that person in the eyes. It's hard to look anyone in the eyes. Sometimes admitting the brokenness to someone else makes it even more real than you felt it in yourself. So having that conversation with your spouse, we have a free partner guide as well to help women navigate this, because sometimes looking that brokenness in the eyes by telling your spouse is hard. They do not want you to suffer. They want you to get the help you need. And then both of you win, because then you get to have that thriving, intimate connection again, which facilitates better connection and better happiness for the rest of your marriage and your family. So it is so important.
Yeah.
So important. And so I want to give credit to Stephanie, Dr. Stephanie Rimka. I don't know if you know who she is, but I saw her last year at Cellcore and I just pulled it up. Her quote of the day was, "All life came from orgasm." And her presentation was all about how we need more play and pleasure in our life to heal trauma and
Mhm.
pain. And I think so often we go through all the nervous system regulation work and all these things, but we forget that like the true purpose of life is to have play and pleasure, right?
Yes,
Like I always say, like, what is life worth living if you're not enjoying it?
I
And
completely
so I
agree.
love that. I mean, I just remember her shouting from stage, "All life came from orgasm," the whole room, yeah. So we're definitely team pro orgasm here.
Yes.
And multiple times a week, I think is, I know some people would disagree with this, but multiple times a week, you should be wanting to connect with your spouse and your partner. I'm not saying
Mhm.
every single day, and we totally understand you have stress, you have kids, and all of that. But Becca and I often talk about this in our personal lives in terms of like, if it's too long, I feel disconnected.
Yes.
And we really like to have that connection. And so
Yes.
that's just shout out to Dr. Rimka for the quote of the day here.
Absolutely.
All life came from orgasm.
I love that. And because pelvic floor and prolapse issues often limit women's not only the ability to play, let's just say, with their spouse in that way and have that laid back, fun, intimate connection, but it often limits women in playing freely with their children in the outdoors because they're worried about where the next restroom is. It limits women in play with travel with their families because there's anxiety about, I'm going to be the one who always has to stop, or it's going to be all about my problems with the bathroom that are going to impact the quality of our trip and her ability to be present. So sometimes we've got to heal this stuff at the root so that we can get back out there and play. And that is so important for our quality of life. I could not agree more.
Yeah. Can you talk a little bit like the physiological aspect of how either tight or, overstressed pelvic floor situations limit orgasms and like pleasurable sex? We talked a little bit about the pain, obviously, but in terms of like an actual ability to have an orgasm, what happens with the pelvic floor that can hinder that?
Well, like you said, a lot of times an over tight muscle ends up being in that pain with penetration place. But it also can just be a matter of, the orgasm comes from a muscle contraction, and an over tight muscle. Again, I don't want to geek out too deep here, but I think back to physical therapy school and those little pictures of the muscles with their little fiber, finger fibers that reach out and connect and grab each other to shorten and contract the muscle. And if they're in an over tightened state, they can't functionally effectively grab and shorten and contract anymore. So that's true from a functional standpoint. If the pelvic floor is over tight, it's not going to function properly to stop the leaks from happening, and to allow smooth and complete passive emptying of the bladder and bowel. But it's also not going to be able to provide the appropriate contractions for that pleasurable orgasm either. So it ends up being a similar limitation presenting in different ways.
Oh, I love that. So, talk to us a little bit about the process that you take people through in terms of like your three steps: assess, and then help to work through the process, and how you are able to help women in shorter amounts of time. Because I know personally too, I've talked to so many women that do pelvic, and I remember this is what my limiting factor was with like being consistent with it. The pelvic floor exercises I was supposed to do were like 30 to 45 plus minutes a day, and like the sessions that I had with my physical, and not saying those are not valuable and helpful, but what do you guys do in terms of assessment and working women through being able to find, you know, other than the 90-90 stretches and
Totally.
relaxation?
Start there. And look, and if you're going, gosh, is this me? I think this is me. I'm not sure. Am I too far gone for conservative help? I've waited so long. I don't know. Start with our 5-minute quiz. Look, ladies, again, we are nerds for what we do. We took the research validated questionnaires and we turned them into an online quiz. And that way we can look women, well, virtually in the eyes and say with confidence, we know what kind of results you can get based on this score, based on your specific case, where your symptoms are, how your case is presenting right now, because this aligns with the research that we did, or it doesn't. And if you take that quiz and your symptoms are past where women in our research responded well, we direct you to other resources. So the quiz is the perfect first place to start. I know we'll have that linked because it'll also help you connect the dots subconsciously. You'll be answering the questions going, oh, wait, that is a part of this picture. Okay, how interesting. I had put that in a separate bucket. And so you're connecting dots and you're going to get that answer like, is conservative care appropriate for me? And do I have hope for healing this way? And if it's not, we'll direct you to other resources that are appropriate. Now, the next step in healing this area is turn inward. You do you, boo. You know you best. Like if you know that you've got to be in person with someone and that is what you need, follow that intuition, follow that instinct, see an in-person provider. What we offer is online. It is fully digital, it is online accessible. We call it DIY, but there's a private support group where we're coaching in there live. We have an OBGYN nurse in there coaching too. It's a great space of camaraderie and emotional healing there because women are supporting each other. But you. So if I'd like to do it at home. I'd like to do it in an approach that keeps my clothes on, that I can do with my kids present. I don't want to have another appointment. Maybe I don't have childcare. Maybe there's not a provider in your area. A lot of those women are the ones who come and work with us. And then you're going to be, after that quiz, we're going to direct you again to the next steps that are right for you. If you end up getting that score that says you're right for conservative care and you end up joining the signature program that we offer, you are going to be walked through some detailed self-assessments. Again, this is all based on the research that we did. You find your starting point. All right, here's where I am. You're going to be walked through relief techniques. One of those is that at-home decompression position, but there's a whole toolbox where it's like, you imagine like you're like Wonder Woman, you're like strapping on your tool belt for the journey ahead, like with really empowering tools that we teach you how and when to pull out based on what symptom you're having, which often those symptoms fluctuate throughout the month. Often they fluctuate as the years pass, as maybe we have another baby and we've had the blessing of walking with women who join our program because it's lifetime access along all of these subsequent life changes, because it can move with you when you have the tools and you know how to deploy them. So we assess, then we add relief techniques to stretch, relax, rebalance. Then we add the therapeutic exercise series. And that's the functional retraining, where you're doing it with an external exercise tool on, with your clothes on, in 3 different planes of movement, in 3 different positions. It's the same protocol we use for ourselves, and then we dialed in our research and tested and validated, and it takes 10 minutes a day. And we were prioritizing that in our own healing journey because we were already moms ourselves. And so this is something that we are so proud and honored to be able to offer. But we always tell women that, you know, there are a lot of options now. So if those boxes sound like, oh my gosh, this is what I've been looking for, you know, take that quiz, start to learn more about what we're offering, search us up on YouTube, Instagram, because you're going to find, do you connect with us or not? This is an intimate area to heal, right? So we want women to feel like safe and supported and okay and at peace with their decision, ready to jump in with 2 feet to whatever it is you decide is the path for you to heal these issues. That will get you the best results possible with that path, is if you're ready to jump in and commit and follow it and go all in.
Yeah, I love that. And one of the things that I would say just on the quiz that I think is really nice that you break it down by different parts of your lifestyle. And I want to call this out as well, because one of the questions was pain or discomfort with tampons. I think so many women don't realize that this is also an issue. I mean, you're bleeding, right? So we got some lubrication there. But if you're having pain or discomfort, I'm going to take it a step further beyond just, the pelvic floor dysfunction and thinking prolapse here, to thinking about, again, estrogen and the integrity of your tissues, because it shouldn't feel like you're pulling sandpaper out when you're pulling a tampon out, right? So I just
Yes.
want to call that out. And then obviously, you're talking a lot about sleeping positions, low back pain. Can I
Yep.
lift? Am I able to walk? Am I able to do the things that I want to do to help me move throughout life without pain? And I think so many women are in some level of discomfort. And I just can't stress enough. I mean, so as the poop queen, I talk a lot about constipation and straining and getting into this proper position. I call it the pooping hygiene, right? Are you
Yep.
getting your knees above your hips? Are you breathing properly? Are you giving yourself time to fully go to the bathroom and not sit there and like try to push it out as fast as possible? Like you
Yes.
might also with your urine, because you're in a rush with your kiddos, like that is going to create some issues. And it's a vicious cycle here, right? With the pelvic
Yes.
floor.
Yes.
So I just love that you call that out, because I think so many people, like you're saying, don't even connect the other parts of life beyond peeing, pooping, and penetration in terms of their pelvic floor and how this might be impacting other things that they desire to do. So I love it. I love everything that you guys are about. And I love that it's 10 minutes because, to be honest, I was sharing this on another podcast. I've had my second C-section. I don't have incontinence or leaking, but I know that I probably have some optimization to do. And taking the time to go see someone in person, and then maybe they want multiple things, it's like, even just feels overwhelming talking about it and
Yeah.
how I'm going to fit that in my day. So this feels much more doable. I love that 90-90 you're talking about. We used to do that in mobility training and things. So I just think that if you're listening to this episode and you have any of these issues and you are also constipated
Yeah.
or experiencing diarrhea, like leaking and
Yes.
incontinence,
Yes. And
just
fecal leakage is a progressed, version of the pelvic floor dysfunction, when it kind of goes more to the back of the bowl, as Jen and I like to say. So we get tons of inquiries in our inbox of, very specific cases and questions. And one thing with when that pressure and heaviness goes more to the back side of the pelvic bowl and you're feeling that more around your rectum, very often, not surprisingly, it's connected to a history of constipation or diarrhea or bowel issues. And we always direct women first in those responses and in our teachings that you're not going to be able to get great relief with the rectal pressure and those issues unless you clear up the digestive dysfunction as the primary piece first. So we would direct them back to you and say, as we always say, it's hard to know sometimes which fire to put out first. So when it comes to like, especially dysfunction at the back of the bowl, of the pelvic bowl around that
I love it.
rectum, you really have to get a handle on consistency with your stools. Like you said, make sure you're getting, not too hard, not too soft, get that squatty potty, use those electrolytes in your water, keep that stool consistency. Milled flax and chia seed, get all that stuff optimized. Get, if it's Crohn's, if it's colitis, if it's IBS, if it's SIBO, get that under control first. Because if you're constantly dealing with chronic constipation and chronic diarrhea, you're not going to be able to rebuild functional strength back there that's going to actually stand the test of time if that piece isn't addressed first. Yeah, so that would be the order if you're wondering like which whack-a-mole do I do I hit
Yeah.
first?
Well, I mean, to
You
be
know?
honest, some of my clients coming in were in month 2 and okay, things have improved, but we're still having issues. I'm like pelvic floor therapy. I don't want to leave that on the table. We don't want any stones unturned. And I've seen it for many women be a game changer for them. Again, on the constipation side as well as this incontinence side. And I just wish
Totally.
that we had these tools in conventional medicine. I was sharing on the last episode, I asked my OBGYN, hey, do you have any referrals? I love referrals rather than just the Google machine. She's like, oh, absolutely. And I totally support this. I was like, why didn't you tell me this before?
Right.
Because I'm
Right.
sure that there's a lot to work on, especially having 2 C-sections and scar tissue and just all the things. So, yeah, I love what you guys are doing. And I think that if you are listening to this episode, you need to go to the show notes. We have the links there. You can go to the Tinkler quiz, take that, and then figure out what your next step is. Like you said, dive in 2 feet. And this is
Yes.
a great call out where you said you can't be 1 foot in and 1 foot out.
Nope.
If you want to fully embrace this healing journey, full circle, it's going to require both, like you mentioned. So I appreciate that.
Yes, and only you can know when it's gone far enough. So many women, it's a different kind of breaking point for each woman as to like what is far enough. But don't wait too long because now it's how far is too far to push the stuff where you can still get better with conservative care is more dependent on symptom severity than age, but often that's correlated. So we get so many messages on under our YouTube teachings and in our inbox from women who are, we hate to have to send them back that answer. This is past what we can help. So this stuff does not get better on its own. And if you're noticing that it's getting worse, that is a great time to start taking some action, because while only you can know how far is far enough to make it worth taking action, slowing down so you can speed up again and restore that function, please don't let it go so far that you are a legitimate surgical referral and that we or another conservative pelvic floor option aren't enough anymore, because those are the stories that just really break our heart. Like, gosh, if I wonder if she would have come to us 10 years earlier.
Yeah. Can we also call out here, yes, and because
Yes.
I'm forgetting the doctor that we had on our show. I just love how she said this. Like,
Oh, Dr. Maritza.
yeah. So
Yeah.
I
to
love her
me,
too.
She's such a good.
I'm thinking about a few people who have had surgeries. So yes, you had the surgery and you can still use this as a tool.
Yes.
But
Yes.
we know that many people who have the surgeries, it's pretty ineffective lasting, that more likely than not, they're going to need another surgery.
25% failure rate. Yeah. With pelvic reconstruction. Yep. It's not good.
So it's a yes and,
Yes.
right? It's if you have had surgery, this can still be a helpful tool.
Yes.
And sometimes you might need both.
Totally.
If you are.
Totally. And sometimes if you're in a post-operative state, much like dealing with scar tissue in any case, it may mean you need to be even more patient with your body's healing process, because then we're trying to gently undo and stretch tension around scar tissue, which is a more fibrous situation. So if you are post-operative and you're still looking for more support, or your surgery hasn't given you the results that you wanted, you may have to be even more patient with your healing process. But this is a great time when we're healing at our center of gravity, our emotional center as women. It's a great time to really tune in and turn inward with compassion for our body and all that it's been through and all that it's done for us. We are the sum of our body's story. And so if you have had a history of chronic constipation, or if you've had a history of asthma as a kid where you were constantly coughing your whole childhood, was downward pressure on that pelvic floor, or maybe you've been a victim of sexual abuse or birth trauma, all of those things, or you played certain really high impact sports as a kid, or you did 20 years of CrossFit, which really strained that pelvic floor, all of those things, we have to give ourselves compassion, because we were all doing always the best that we can. And so all those factors do impact our pelvic floor health over a lifetime. So while sometimes it feels like this stuff happened all of a sudden, really we need to pour in healing and kindness and compassion for what really is probably more like many decades of change that we're kind of trying to work through and reprogram.
Yeah.
Yeah. I mean, this has been amazing, and I think will be very helpful and validating for a lot of people to hear. Let people know where they can find you. If there was like, we always ask if there's one thing that you could give people advice on, one piece of information, one thing you would scream from the mountaintops, like what is that?
Listen to your body. It is trying to communicate with you. Every symptom is a message. And we are often trained culturally to ignore those things, to block out our intuition as women. That is never the right thing to do. If your body is leaking or hurting, it is trying to wave the white flag and say, hey, this isn't a good fit for me right now. And it doesn't mean you can never do it again. But if you continue to do that thing that's hurting or making the symptoms worse, it's going to make the condition worse over time. So when you are noticing that something is not right with your body, trust that, tune in, listen, pull back, give yourself that compassionate care that your body's asking for, then go back to those things that you were loving to do while there's no longer dysfunction. And then you won't be hurting yourself. So listen to your body, trust it. You know you best.
All right. And let people know where they can find you.
Yeah, we're at tighten.your.tinkler on Instagram. We're Tighten Your Tinkle on YouTube. Our website's tightenyourtinkler.com. And start with that 5-minute quiz. If you're not sure, that is the best place to go. But, go down the rabbit holes with us. We have teachings on everything you might be afraid to Google, all aspects of pelvic floor health and prolapse on that YouTube channel.
Amazing. Thank you so much. And we will be back with the next episode.
Thank you, ladies.